Go. Good afternoon, everyone. We're so happy you are here. My name is Gary Parker. I'm the Associate Dean for External Affairs and Director of the Clark Fox Policy Institute at the Brown School at Washington University in St. Louis. And welcome to our COVID-19 and Race series. In response to the multitude of ways in which COVID-19 has disproportionately affected communities of color, the Brown School and the Clark Fox Policy Institute has organized this series to elevate the voices of local leaders, physicians, researchers, advocates, activists. And we want this series to be a platform for highlighting multiple perspectives, and we want to draw on community-based and evidence-based knowledges to address the challenges of Black, Brown, and Native people. So we have an incredible panel for you today, and we want you to be a part of the conversation. So please, use the chat feature to send us your thoughts and your questions, and our moderators will curate those and share them with our panelists, and we'll be able to kind of pull you right into that conversation. But before we dive into the impacts on Latinx populations, I want to thank our co-sponsors. This program is offered in partnerships with the Brown School Center for Mental Health Services Research, the Prevention Research Center, and the Open Classroom Series. I want to thank Janet Gillows, the Director of Professional Development, who has launched the Open Classroom Series to really a success that we had not anticipated. If you'd like to go to the next Open Classroom, it's July 2nd, just 2 days from now, and it'll be on how small businesses support a community and how to protect them. And for that, we have Dr. Heather Cameron, Kaufman Professor of Practice in Social Entrepreneurship. I want to tell you just a little bit about this COVID and Race series. This is part 5. Part 6 will be on July 9th at 12:30. It's talking to children about race and social justice. This actually came from a request from one of our participants who's been coming to the series, and we wanted to be responsive. I will put a link in the chat to where you can register for that. Also, I'll put a link where you can find the previous 4 parts. You can check those out. You'll see we looked at the impacts on Native populations. We look at political action in the age of COVID-19. We look at the mental health and emotional well-being and the impact that that's having. And I really think that you will enjoy watching those previous episodes. So I want to introduce our moderators, and we have everybody knows Atia Thurman. She's the Associate Director of the Clark Fox Policy Institute, and just an all-around amazing person and an advocate for advancing racial equity. And a very special co-host and co-moderator today is Robert Sagastume. Robert is a Brown School alum. He has both an MSW and an MSP. He was inducted into the Clark Fox Policy Institute Graduate Policy Scholar. He also interned with the Institute and really was fantastic. He's currently advising students through the Scholarship Foundation of St. Louis and formerly served as a senior member and advocate of the Kansas-Missouri Dream Alliance. Please welcome your co-hosts, Robert and Atia.
Welcome. Thank you so much, Gary. According to the Center for Disease Control, the CDC, long-standing systemic health and social inequalities have put some members of racial and ethnic minority groups at increased risk of getting COVID-19 or experiencing severe illness, regardless of age. One of these groups is Hispanic Latino persons in the United States. Now, while this group only accounts for less than 17% of the total US population, they're experiencing rates of hospitalization 4 times that of non-Hispanic white persons. The pandemic is having an intense impact on the Latino community across the United States, especially their most vulnerable, isolated seniors, immigrant populations, Latino families, single-parent households, and small-owned Latino businesses. The effects go far beyond the physical and mental impacts, and they're extending into the financial well-being and the ability for Latino families to take care of their families and take care of their communities. Because again, there's a disproportionate representation of Latino people in the frontline jobs. So they're at risk for either being laid off or downsized, or they're at great health risk because they're in the frontline positions. And they're experiencing a record high job loss as a result of the pandemic. I want to say thank you, guest speakers, everyone who has shown up for this conversation. We appreciate you joining us for the 5th episode in the COVID-19 and Race series, Health and Economic Disparities in the Latinx Community. I am Atia Thurman, Associate Director of the Clark Fox Policy Institute, and I'm grateful to be here. I want to say thank you to Gary Parker, Executive Director, Producer of this series, and the Director of the Clark Fox Policy Institute. I want to thank Janet Gillow of the Brown School. I want to thank Maxine Clark and Bob Fox, and I want to thank all of our wonderful panelists for being here today to engage us in this conversation. I would like to, at this point, turn it over to my co-moderator, Robert Zegastubi.
Thank you, Atia. Thank you very much, Gary and Atia, for having this tremendous honor to be with an incredible panelist today. And I am truly lucky and honored because this is something that is often heavily impacted within the Latinx community. And sometimes we don't have platform or spaces to have this type of conversations, and how it does affect our Latinx immigrant community in the United States. With further ado, I would like to just jump in right at the bat. And if you like, you can just do it at popcorn style, and we will just, if you can just all introduce yourselves with your name, title, or an organization. And I would, just say a brief statement of how COVID-19 has impacted the communities and how you are all serving the communities here in the St. Louis area and abroad. So feel free to jump, anyone.
Let's go by order of last name. So I'll start. Bente. So good afternoon, everybody. My name is Diego Bente, and I'm the president and CEO of Casa de Salud. Casa is a 10-year-old nonprofit based in St. Louis City, and our mission is to provide high-quality clinical and mental health care to uninsured and underinsured folks in our region. And of course, we focus on immigrants and refugees, especially those who speak Spanish, who encounter barriers to accessing care from other sources. Last year, we engaged 14,000 folks who represented over 60 different countries and 30 different counties. And I struggle to summarize how COVID has affected our patients and clients, because it has had such multifaceted effects and prolonged effects on the community. I would say that isolation in all the wrong ways has been something, a theme that we've encountered, folks feeling like they are not being spoken with, not to, but with, folks who are not being empowered to take an active role in helping the community respond to the crisis, because it's clear that that's what's required of the community, but that also comes with it the sharing of information and the establishing of spaces for conversation. So that's one of the most, the deepest underlying themes that I've seen in our community, is that they want to respond, they want to be empowered to help us move through this crisis, but they need to have the information in their preferred language that allows them to do it in a way that those of us who have the privilege of preferring to speak and read in English can do so. And so that's something that CASA has really been concentrating on in the past several months, really helping bring them along and creating a community response versus individual isolated responses directed at certain portions of the community.
So if we're going by last name, I'll go next. My name is Leopoldo Cavazza. I'm an associate professor at the Brown School, also the co-director of the Center for Mental Health Services Research, and the director of our training program, pre-doctoral and postdoctoral training program, Mental Health Services Research. To me, this has been, there's been many ways that people have characterized what's going on and the intersection of both the COVID-19 with all the racial and ethnic issues that have been going on and injustices that have come up. And I would say that, there was a great article in the Boston Globe actually at the beginning of the of the pandemic for Marcela Garcia, who basically characterized the COVID-19 as the great revealer. It sort of revealed to the large segments of our population of these deep racial, ethnic disparities in health, in economics, in housing that have been impacting the Latino community for decades. And this has created further bring further understanding of those disparities and the impact that it's having. And the work that we do, we focus on the mental health, and it's very concerning to see, I think, as Diego has mentioned, the isolation that's happening, the lack of information, and then the support from federal, local, and state level for our communities, and the rhetoric that has been mentioned at all levels against our community. It's very concerning in this particular situation that we're going through right now. And it is impacting, as I mentioned, health, mental health, social, economic components. So I think there's a lot of work to be done here, lots of important components, and it's all coming together in a really difficult manner of how we can help the Latino community, which is diverse, which contributes to the political, social, and economic well-being of our country. This is a population that is contributing to the progress of this country, and not being provided the services and the help that is needed at multiple levels. So I think it's really important that we're paying attention to this, and I'm very excited to have this conversation with you guys today. So.
Thank you, Dr. Cabasa.
Okay, I think I'm next in the alphabetical lineup. Hi, everyone. My name is Alicia Hernandez. My gender pronouns are she, her. I am a community organizer. I kind of hold a lot of hats. I'm a board member with Forward Through Ferguson. I work at the ACLU of Missouri as an organizer for the Eastern Missouri half, working to advance our policy agendas. I'm also a co-creator and organizer of the St. Louis ICE Rapid Response Line, and I've been assisting with some mutual aid efforts in St. Louis. Yeah, the question, how has the pandemic most impacted communities that you serve, that I serve? That's a tough question too. And I think before I answer, I'd like to amplify something that I think we all know, and it's that Latinx people are not a monolith. It is an ethnicity. However, we also hold different identities. There are white Latinos, Black Latinos, brown Latinos, different class levels. And what I've seen most, as others have already alluded to, is a lot of the systemic issues are really showing up. They're really amplifying. Language access has been a major issue from the beginning, and it's been a continued fight. So has finding financial assistance for people, especially for undocumented people, which was one of the reasons I really wanted to get involved with some of the mutual aid efforts, because those resources weren't available to people who needed it. A way that it has affected my role and my focus, I do a lot with policy. I'm also part of the Missouri Immigration, it's a statewide policy coalition. COVID sort of hit during the end of Missouri legislature, and COVID continued on during these uprisings that we're seeing with police brutality and the Black Lives Matter movement. And although we've got to advance these fights and we've got to, motivate and mobilize people, there are also people who are being affected by the pandemic, and that's something to keep in mind while trying to continue advancing, but also taking care of people.
Thank you so much, Alicia.
I guess it's my turn. So I'm Deborah Salvo. I'm a faculty member at the Brown School, assistant professor of public health. I serve as a co-chair of our epidemiology specialization. And a little bit about myself to contextualize my vision and my view of all this. I was born and raised in Mexico City, have been living in this country for 10 years now. Came for a PhD, postdocs, positions, etc. And a lot of my work, in non-COVID times has to do with understanding how city and urban environments influence health behaviors or people's ability to stay healthy, physical activity, healthy eating, smoking, other things. And at the beginning, it would have seemed that, I'm not somebody that focuses on infectious diseases, et cetera, but COVID has impacted every single thing that sort of matters. And thinking of how cities influence people's health, we really are seeing with Latino communities across the US and globally, really like a zip code breakdown, which can be simplified and shouldn't be, I think, but some people do just by SES and seeing like, oh, we have more cases here. But when we start looking at race and ethnicity, we do start seeing that our communities, where Latinos live and where Black people live and other minorities live, are disproportionately affected by this pandemic, both in terms of number of cases and number of severe cases and number of deaths, but then all of these additional consequences that we're talking about right now. I think something that Leo brought up is extremely important, mental health. And Diego brought this up too, the isolation that is coming with this. And I think we have to remember that a large portion of our community, echoing what Alicia mentioned, we're not all the same, not all Latinos are created equal or hold the same identity. But a large portion of our community is already in regular times when we don't have a global pandemic and social unrest, feeling very isolated in this country because of their immigration status, right? And because of language and because of many other factors. So this has just magnified all of these fears and all of its negative consequences. In terms of going back to the health side, what we're seeing of how our communities are affected is, yes, they're getting more COVID, they're getting worse cases of COVID, they're getting worse attention, they're seeking attention late, and we have more deaths by COVID among Latino populations in the US, unfortunately. But in addition to that, everything else, what I study, for instance, our ability to be outside in the city and get some physical activity, get our children to play, socially interact, etc. All of that is being affected, which also carries a burden for health. A recent study by one of our colleagues here at the Brown School showed a projection of increases in childhood obesity, for instance, due to the COVID-19 situation. And the group that is predicted to be most highly affected are Latino children, for instance. So we're seeing a lot of that. I'll stop talking in a second, but one last thing that I'd like to say is that social isolation affects anybody. But I think thinking of our culture, we are extremely social. We are community oriented, right?
Yes.
So Latino culture is all about that. It's not to say that other people can be okay in being isolated for 3 months at a time, no, but we're definitely not well equipped for that. And we're already existing in a society where the mainstream isn't that community oriented. So this is just, again, magnifying all sorts of problems that we have. And I think we really need to pay attention to what the drivers of health and social life are in our communities in regular time, and then see how this is impacting it. A lot of resources are missing for our community. And I misspoke. My very final point is, if anyone, probably in another conversation at another time, but ever wants to also talk about and learn a little bit about how COVID-19 is impacting things in Latin America, I'm doing a lot of work on that too right now. So outside of the US, because, developing countries, it's everything blown up even worse, because of the inequalities. Thank you for the invitation. I'm very excited to listen and to learn from everybody. And yeah, I'll leave it at that for now.
Well, thank you very much, Dr. Talbo. I think, it is, wow, it is at the core, everything that it has been highlighted. It is at the core of what this conversation, aims to be, making sure that we understand the complexity of things that happen in the magnitude of like COVID-19, but also thinking about all the layers that comes with the, some populations within the Latinx community being undocumented. From personal experience, as a former undocumented person myself, living in the US for 15 years, and still having some family members in that position, mixed status families, for example, some of them were not able to receive a stimulus check, and how that impacted their lives, right? So I think you all highlighted key things that we need to think about. And with that kind of mindset, if anyone would like to respond to this question, I am really curious to have a better understanding of how different organizations or the different work that you're conducting here locally in St. Louis is being mobilized among the community when you are probably in your own way facing some challenges with misinformation that may be coming, or misinformation or contradiction information that might be coming from a federal level, and then trying to implement that in a local state level. Anyone?
So if we're going to keep the round robin going, I guess it's my turn again. There's so much to say here. So first thing I'd like to say is, I think that let's think about this as potentially working on two sides of a coin. On the one hand, what we can do as purveyors of trust to the community who have served the Latinx people in our community for many, many years, what we have to do is work with the local authorities to help them learn from this opportunity. So COVID is going to give us a series of opportunities in succession. What we do, what we learn, and how we improve each successive time we get to interact with COVID and community is what history is going to remember our response as. So maybe the transmission rates at the beginning surprised us all. Maybe we were all mis or underinformed, but now we know. And so what can we do with that information as we move forward into post-social distancing and the long reopening and phasing back into post-social distancing? And one of the first things we can do is help our local authorities think about communicating first in plain language, which is to say in the vernacular, right? In plain words that are simple, that are easy to understand, even in English, so that as you start to translate them into other languages, and Spanish being one of them, you already have a really good foundation that's easy to communicate. If it's not easy to communicate in English, or if it's got a lot of really heavy academic or scientific language in English, chances are it's going to translate very poorly, no matter how hard you try. So I think that's one thing that we can do. The other thing we can do has a lot to do with Deborah, what I was sharing. Well, Deborah, sorry if I got that wrong. It's about culture, and it's about recognizing that culture is complex and it's multifaceted. And so my culture as a Paraguayan is very different than an Ecuadorian culture or a Mexican culture, even though we share a language. And even there we have different words. And so helping our local authorities understand that plain language helps translate everything into a more common version of the vernacular really helps to communicate a unified message. And that's really important, because one thing I think in the rush of things we always fail to really value is that even though folks may prefer a language that's not English, that doesn't mean they can't understand, read, or consume information in English. It's just not their preferred language. And so when they see something being said in English and something different being said in a different language like Spanish, they're going to start to question the fidelity of the information. And they're going to start to ask themselves, is this really speaking to me in Spanish, or is this just sort of an afterthought to say that it was done in Spanish? So I think that's the first thing. And I think the second thing is working with the folks in our community to extend the trust and to bring folks along and keep them engaged in a conversation as we go through, as we carry on in the marathon that is the response to COVID, right? It's not about one touch point. It's about creating a space to bring people along as new and more information is released, as we live and learn and understand how to better protect ourselves. One great example is face masks. I mean, in the beginning, we were all told face masks were only for first responders and people in the front lines. And now folks are being asked to wear face masks outdoors. And in some places are now even being asked to wear them, or sorry, indoors. And in some places are now being asked to wear them outdoors as well. So the information is evolving. And what we can do as we serve these communities, because we have trust, because we understand the language, because we recognize the complexity of the different cultures that are coming to the table, we can start to communicate with them that this is a conversation and that we'll be in this until we get through this. It's not a sort of one-touch ad hoc process. I think that's really what we have to keep in mind as we move forward. And that's what we have to convince the community that we're offering, so that they will step in and step up and do their part, because they're looking for a little bit of reciprocation, right? Because this, if we're all in this, then we all have to be in this.
Absolutely.
Thank you so much.
Go ahead, Atia.
I appreciate that passionate response, Diego. I do. And you answered about 3 of our questions as well when you did that. There were 2 things I heard earlier. One of them was rhetoric against the community. And I keep hearing a lot of us talk about like this disparate impacts, this disproportionate, that we're experiencing this at rates higher than we should. That's what's implied, right? And the other part I'm really hearing is that there's a divided experience. There's a divided experience in this United States between people of color and white people, often, or by class, or by, and the more I learn, the more I realize that that division in our life outcomes is by design. And so I want to reflect on some of the current conditions, pre-pandemic, not current, pre-pandemic conditions, pre-pandemic policies, pre-pandemic, the things that set us up to experience this with such greater devastation and such greater divide, that our experience is so disproportionately, you know what I'm trying to say. So I'd love to hear a little bit about the things, those preconditions that made us more susceptible, that made people of the Latinx community more susceptible. And then we're going to shift and think about what needs to change so that that's not the case anymore.
But yeah, I see that's a great question, and I think it goes directly to the root causes or the fundamental causes of health disparities. And in the Latino community, so there's 2 major ones that I can highlight. One is the employment. We are a population that's working, but it's working at the jobs and the industries that are mostly impacted, and that are people and that are not provided with the right resources and the right protections against COVID-19. If you look at for example, our food chain, from the people who pick it, to the people who package it, to the people who process it, to the people who cook it, serve it, all of that, we're overrepresented in the Latino community. And that's an industry that has not been well protected in these times of COVID-19. Our people are working, they are out there, they're exposed, and there was very little that was being provided to this population. These essential workers are there. That's a community. The other major component, which it's sort of a policy component, the rates of uninsurance in the Latino community across this country. The lack of having access, basic access to healthcare. It's really troublesome in the Latino community. Latinos are at a much higher rate of being uninsured. They have the highest number of uninsurance, almost 3 times more likely to be uninsured than non-Hispanic Blacks, than non-Hispanic whites. And that's very serious. So that prevents people from accessing the healthcare that they need. And in a pandemic, when health is so precarious, and the idea of if you get sick, you need help, not being able to access that, for not having insurance, not being able to address that, and then all the fears that have come up over the past, I would say 8 years in regards of immigration as well. It's a major component that prevents people from seeking care in times of need in a timely manner, without having the repercussion of what's going to happen to me or my family as you're trying to seek help. So there's just all these other conditions that were there, and people have mentioned it. I think Robert has mentioned it, Diego has mentioned it, that are really impacting the health and the social well-being of our population. And and it's happened. And then the diversity of all these issues within in places, every state has a very different type of a policy around some of these issues. Some of them are better at helping our community. Some of them are not very well, or even still neglectful from providing services to our community. So all of those things, I think, play a role here in these conditions that have been really amplified because of the COVID-19 pandemic and everything else that's happening.
Yeah, I'd just like to add to touch on what Diego mentioned earlier. One of the biggest preconditions that I kind of came across through some of my work was language access. From the very beginning, there were wonderful nonprofits who've continued to raise up to the occasion and step up and do the work. But it was quite frustrating talking to leaders in the county and in the city. They were scrambling, and a lot of these nonprofits who were already at capacity dealing with clients and members were the ones who had to step up to deal with this and to kind of pick up and translate and interpret and create hotlines. And so it was really clear that this should have been in place already. These resources, these conversations should have been had, so we weren't trying to stumble and figure it out now. I know, for example, in some of the mutual aid work, we had a bilingual hotline, and we were actually helping people navigate the healthcare system, the unemployment system, the housing system. Like, they needed to call departments, but they couldn't find actual Spanish speakers. And there might have been Spanish speakers advertised as being on the line, but even these hotlines were like in such distress and overcapacity that it just wasn't meeting the needs of people. Similar to what Diego said earlier too, like building trust. I see some people with Prepare STL on the call, so I just want to give a shout out to Bertini and Juan. Prepare STL was awesome. They were doing canvassing. They were hiring, actually paying canvassers who were native in these languages: Spanish, Bosnian, French, Arabic, Vietnamese, Chinese, going out to businesses, going out to places where you would find these communities, giving them flyers and posters, yard signs, talking about the importance of personal protection equipment, social distancing, all the really important things that are sometimes hard to talk to with different communities, and actually giving them PPE kits. And that was just really great to see, in a need at the time. And it was a really cool thing that community members from those communities were the ones who were going to have those conversations with people. I think that was really impactful.
And if I may, oh, sorry.
No, go ahead, Dr. Salvo.
You can call me Deborah. If I may jump in, I think a lot of great points have been raised. Something that Diego was talking about earlier in response to one of the questions about disparate messages happening at the federal level, state level, local. I think with our communities, with Latinos, there's an added complexity. How do we get our information, especially when we're seeking it in our language, etc.? I'll WhatsApp my mom in Mexico, right? Or I'll look at a channel, a TV channel that may not even be produced in this country. Sometimes they are and sometimes they're not. Or social media, etc. So we have the disparate public health information, and that doesn't have to do with ethnicity or race. It's just disparate, unfortunately, what federal government is saying and local departments, etc. in the US, plus what the world is saying, what Latin America is saying, and different countries are saying. And all of it is getting mixed, and our communities are getting information from all sorts of different sources that may not match what's happening here or what's being recommended here. So I think going back to the topic of all these translated materials, resources, people that can speak the language, Spanish and Portuguese, is extremely important. It's not just a technicality, and it's not just a matter of sort of very fast translating something so that it seems that it was done in a rush and sort of doesn't even make a lot of sense, because a lot of times we get that reaction, ourselves included. I think when I see a Spanish material by the CDC or by whomever, and it doesn't really speak to me. So I think one of it is the language and the resources. The other thing is really speaking like a cultural adaptation of messages. I very briefly was going through the chat and saw that Dr. Rodrigo Reyes brought up two very good points, and I think he's answering his own question, I'm going to call it. But one really good question is, you know, how can we give unique messages about COVID-19 to our community that are not necessarily for the general population? And the previous question he says is, you know, like social distancing versus physical distancing. We were talking about our culture. Our culture is so social. You know, remove the social, it's like our essence. So that's probably a really bad message to just be translating distanciamiento social. We probably need to emphasize the physical side, and we probably need strategies beyond health, beyond PPE, etc., to sort of show people how you can have a good social family life, neighborhood life, with the physical distancing, for instance. And I don't see that happening, because I think here the mainstream population, or whatever you want to call it, white America, is usually okay. Like if you're told to stay alone, okay, you can stay alone, but that won't necessarily work for us. It's such an intricate part of our culture. In addition to everything that Leo was talking about, the jobs, you know, all of us, not us, but a lot of our community has are essential workers, so to speak. So they haven't had this luxury of just staying at home, Zooming all day, right? So we really need to speak to the reality of our population and have much better messaging that goes beyond a face-to-face translation.
Can I got to step in here? Just one sec, sorry, this was just great. So what I said at the beginning of the crisis, when folks were asking me, like, how can you better communicate to the Latino community about this, or Latinx community, I said, well, they definitely don't want to look it up on WebMD, right? They want to talk to somebody. And I think that's a really good point. It's not that the information isn't out there, it's who's the purveyor of that information. And I think that gets back to trust, because yeah, you could get your information from a lot of different sources and it could be more or less right on several points, yet also in contradiction in several points. I've seen flyers where, you know, they've bullet pointed the people at risk, and in English it's, you know, older people, people with underlying conditions, and in Spanish they've added pregnant women. And so when people see those two things, they're thinking, what's going on here? Why are these two different messages? And so if you've established trust and you've established a conversation, someone might come back to you and say, hey, I see these two messages, what gives? And you can walk them through what's going on. If you haven't established trust, to Deborah's point, you're just gonna go to whatever you think, you know, is the most trustworthy source, which may not be. And I think two more real quick things. One, on the hotlines, it was shared about a month ago now, maybe a month and a half ago, that on average it took someone who wanted to access the information in a language that wasn't English, on average, double, if not more, the amount of time to get through a call than it did someone who was just ready to talk in English. So if you're already stressed, if you're already confronting, you know, the 100-year pandemic, and you're being asked to stay on the phone twice as long as everybody else to get the information you need to be safe, the likelihood that you're going to do that is pretty low. So I think that can't be stressed enough. We have to improve the ability to receive preferred language access to the hotlines. And then the final point on essential workers, on safety net, on the economy that Leopoldo so eloquently shared, is that if the economy was doing very well before, with that share of Latinos contributing to it, and it was so cumbersome that something like this could have affected it so negatively, if we really want to rebuild that economy, if we want that V-shaped recovery, which, let's be honest, it's not going to happen, we can try, we're going to have to work with this Latinx community, because they were the ones that were making the thing go in the first place, or at least they were contributing to a large degree. And I think that speaks to the inclusiveness of how we confront the public health crisis so that we can succeed in the rebuilding of the economy.
Thank you.
Sorry, go ahead, thank you.
I want to, yeah, so there was a theme here a little bit about language, communication, trust. The thing that I learned about this pandemic was that we were, so much of the success of protecting populations and protecting ourselves and our loved ones, so much of our success hinged on individual behavior. And communication implies largely that getting the communication out there means we want people to do something different, right? But now I want to ask you about large scale behavior. I'm going to ask you the policy question, because we want people to behave differently, but there's a lot of things about how the systems were set up before this pandemic that made it hard for us to even have, like you said, access to healthcare, access to certain types of employment, language not necessarily being a barrier, but really being a second thought in a lot of places where they weren't giving thought to the language. So now I want to ask, what policies need to change? What policies should we introduce that would bring us, that would close some of the disparities between, you know, we can say between white and Hispanic, Latinx, non-white, but to close some of this divide and this gap, what policies need to change or be introduced so that we're not asking, right now it feels like all the responsibility lies on individual people, and I know that's not what this is about.
So I'll jump in if nobody wants to jump on this one. This one's a good one. I think that to me, there are many policies that need to change. And I will speak for two of them that are sort of close to the work that we do. Health insurance. We need to do a much better in providing basic health insurance and health services to everyone, regardless of where you come from, where you're at, regardless of whether you work or not. Our health system needs a major change here, and everyone deserves access to care and good quality care. So that is a major component, and that can be done from the local all the way to the federal level. And we need there's serious issues that need to happen. Missouri is going through one of the major components right now, trying to get the Affordable Care Act. I've lived in different states in the country where Affordable Care Act was enacted or not. It helps, but it's not sufficient. We need much more comprehensive healthcare reform. So that's one. The other component that is one that I'm really concerned about, because I've seen it over the past 4 years, is voting. Latinos need to show up to vote. I mean, and the ones that have the right to vote need to exercise that right in every single election at every single moment. And to me, that's really personal. As a Puerto Rican who did not have the right to vote until I established residency in the United States, voting to me is an essential right. For 18 years of my life, I was a US citizen that did not have the right to vote because I lived in Puerto Rico, the last colony of the United States. So we need to continue to exercise our right to vote in the Latino and increase the number and right to do that. So those are two major policies and make it easy for people to vote and stop with and there's major threats to being the right to vote, voter suppression, voter intimidation, making it hard to people. I can give you story after story of issues that come up, both people I know and personally, on how to exercise my right to vote. So those are two major components: voting for the change and then political participation that we have. But there's many others, and I'll let the other component, but those are, to me, essential ones. So.
Yeah, I'd like to expand a bit on the political participation. Yes, voting is absolutely important. And I'm thinking more with like my ACLU hat right now. Missouri legislature has tried time and time again to suppress our voice at the ballot box. They've refused to pass Medicaid. And I realize undocumented people don't have access to Medicaid, but there are a lot of Missourians who do not have access to Medicaid right now. So I think it's extremely important to vote, but to also be as engaged as you can, not just federally, but definitely at the state and even municipal levels, because a lot of those policies impact us in major ways. And we've seen Missouri legislature attempt some anti-immigrant policies lately, and that gets scarier and scarier. On top of that, of other policies that I would say is definitely the CARES Act funding. I'm a little more clued into how it's moving at the Board of Aldermen in St. Louis City. I know we're not having this conversation, but some of the CARES Act funding is potentially going to police departments. And right now that's not where that money should go. You know, it should go to housing, other resources. So definitely things need to change with where CARES Act funding is going. Governmental assistance, like I said earlier, A lot of people don't have access to some of this, the stimulus checks and aids that are coming through. And then I would also say the way nonprofits function, this is not necessarily a electoral like policy, but more just how we function in cultural, with nonprofits really rethinking our grant structure and our aid structure, really trusting in people's agency to know and trust that people know what they need. And when they request for assistance, removing those barriers to give them what they need. Someone needs money for rent. Why put in steps in place? Just give them the money. I think that's one of the beautiful things about mutual aid that I've seen really flourish.
And if I may just quickly, thank you so much for everything that you have all said. And as we are in this space, I think it would be irresponsible for all of us to share some of the things that are happening here locally in St. Louis in Spanish. So, lo siguiente se lo voy a decir a ustedes en español para que nuestra audiencia que habla español pueda entender un poco. ¿Cuáles son algunos lugares o organizaciones o esfuerzos que ustedes conocen aquí localmente en el estado de Missouri, específicamente en la ciudad de San Luis, que muchos individuales o personas pueden ir por ayuda mientras puedan ser impactadas por el COVID-19?
Bueno, en general, las puertas de casa están abiertas para todos los latinos y en general, todo quien no pueda acceder servicios de salud mental o servicios de salud de clínica primaria. Nosotros abrimos las puertas y estamos a disposición para servirles. En particular, con respecto a COVID, estamos organizando una serie de días donde la gente puede venir a acceder a un examen de COVID. Y puede también recibir información sobre cómo tratarse y cómo y dónde acceder a la información a medida que va cambiando, a medida que va evolucionando. Así que en cuanto a su salud mental y su salud física, Casa de Salud es siempre un lugar donde pueden venir. Otro recurso que me viene a mente, que es muy bueno, me parece, es STL Juntos, que es una página de Facebook que realmente agrega, concentra y coordina la información que las ONGs en la región están, sobre la actividad de todas las ONGs en la región. Entonces es un buen lugar centralizado donde uno puede enterarse de lo que está pasando y de quién está proveyendo cuál servicio. Porque una cosa que quiero realzar, digamos, es que la respuesta tiene que ser una colaboración entre muchas y todas las organizaciones. Y no solamente las que puedan proveer servicios en español. Va a ser un esfuerzo comunitario el que nos va a ayudar a sobresalir. Entonces, nuestro esfuerzo es importante, pero no es el único.
Muchas gracias. Thank you very much for that. Just so you know, also, just a really quick plug-in, I know that for families who have been struggling with food and food insecurity, LifeWise STL has been doing an amazing job providing some of food efforts for families. So, si ustedes son una familia que necesitan ayuda con recursos de comida, les recomendaría que revisaran información sobre la organización que se llama LifeWise. Anteriormente se llamaba Kingdom House.
Una cosa más que se me ocurre, Roberto, ISPN y SPN es una colaboración de todas las ONGs que proveen servicios a inmigrantes en la región y ellos tienen un programa en particular de servicio de transferencia de recursos directos, como hablaba Alicia, de ayuda mutua, que permite que las familias accedan los recursos que necesitan para las necesidades que tengan, ¿verdad? Y es una transferencia directa, lo cual me parece muy interesante y muy necesario en estos momentos. Así que quería también agregar eso.
Muchísimas gracias. Thank you very much. Do you have anything to add, Atia?
Huge thank you. And we have about 6 minutes left, and I've just kind of been looking through some of the chat, and I want to say thank you for all the comments and for the questions. And I know we've been able to get to a couple of the questions. Rodrigo did ask about undocumented Latinos getting access to COVID-19 testing in STL. And I don't know if there's specific places that people are directing them to, or is all testing good, does it feel like safe testing? I'm not sure for undocumented population. I do want to ask the speakers, because we're going to be wrapping up our time, and we never have enough time. So, if we need to make more time, then let us know, we make more time, because this is such a rich conversation. I think Robert and I probably maybe asked 1/4 of the questions we wanted to ask you or less. So one of the things we do is, before we leave though, we want to make sure that you have a chance to leave a lasting message with this audience of 100 people who are here, who've joined us today, that you get a chance to either give them a call to action. I want you to think about, if I say, I want to be in solidarity with you, I want to be in the space with you, what does that mean? Someone said a lot of trust and relationship building. What does it mean right now for Black and brown people to stand in solidarity? What does it mean for white allyship to stand in solidarity? What's the call to action or the lasting message that you want to leave with us today?
Well, I'll start. Well, first of all, thank you for having me here. This has been extremely helpful for myself too. I've learned new things I didn't know. I think my message is that independent of your status in this country and your situation as a Latino here, your health should be a priority both personally and for our society. As Leo very clearly said, our society is so dependent on Latinos, and it's so under-acknowledged. Basically, our entire food supply system and many other pretty much essential services and systems in this country only subsist because of Latino labor. So I think it's a moment to take pride in what our society contributes, or what our community contributes to society here in the US at all sorts of levels. We can see that whenever Latinos are not in the room or not in the economy, the economy tends to collapse a little bit. So I think it's the time to really demand better information and better services to keep our community healthy. And I know that it's difficult. Even myself, as somebody that was very privileged in coming here with visas, and I'm on a green card, etc., there's fear. There's always fear of what you're entitled to and what you're not. So also learning information or seeking the information on what your rights are, because we all have rights here, including undocumented migrants, and we all have services that we can seek. And in a time of crisis such as this one with COVID-19 and with other situations happening like social unrest, it's very important first to inform ourselves of what actually are our rights here, and then what should be our rights, what should we be aiming for, and where should we be going. So I think take care of yourselves, cuídense mucho, y sigan la lucha.
Gracias.
Yeah, I'd just like to uplift too. So I mentioned earlier, I'm a board member of Forward Through Ferguson, whose mission is really rooted in racial equity. They've created something recently. It's a new program. It's the Racial Healing Fund. A lot of times, a lot of us in this work are impacted people, and we're dealing with a lot of trauma and like systemic racism and the history of it and the way it's impacted our families, our communities. And I think that this is a great opportunity for anyone to just start to get involved, learn a little bit more about what is racial healing, what is the purpose of the fund, get a little more introduced to Forward Through Ferguson. So yeah, that would be my call to action to y'all.
Thank you. Appreciate it.
I would say I want to muchísimas gracias for this opportunity to talk today and have this opportunity to share our ideas and our voices. My wrap-up comment in a sense is for our white allies to continue to learn about the Latino community, to understand and ask questions and inform yourself of who is this diverse population that is contributing so much to our country. Why are we here? How can we work together at all levels, and inform yourself about the rich history and cultures that are here and are part of the United States, and continue this conversation. That will be my wrap up. And muchísimas gracias por esta oportunidad.
Thank you, Dr. Gomez.
Bueno, igualmente para mí, muchísimas gracias por la invitación y un placer poder hablar de algo que me toca tan cerca al corazón y tengo tanta pasión por mejorar. Here are my parting thoughts. As practitioners, educators, advocates, researchers, as we speak to the communities who will listen to us and trust us, let's empower them to take agency and to be part of the solution at every stage of the COVID response, which we've already shared is not going to be a short one. And then as practitioners, educators, researchers, activists, let's look at who's standing shoulder to shoulder, and let's play to our strengths. Let's support each other, and let's work across our specialties so that we can uplift the entire community. It's been said often that COVID doesn't discriminate in how in its transmission, but it certainly, as we've seen in the data, discriminates in the way that it's affecting certain populations. And I think we've got to work on both sides of that equation in order to get through this successfully. And the only way that we can do that is by continuing to work to spread trust in the community and to continue to work as people of privilege to use that privilege for the greater good.
Thank you all. Thank you. Those are definitely amazing remarks. And if I may, Itia, I also want to say one last thing to our community members. Yo sé que es duro estar no cerca de tus familiares y poderles dar un beso o un abrazo. But think about, todas esas personas que pueden ser impactadas y puede ser algo de vida o muerte. So just making sure we take the steps that are needed in place to make sure that we're not only keeping ourselves physically stable and good, but also mentally and emotionally.
I want to wrap up by saying you all thanked us, but we really want to thank you making time for this. Really, we want to thank you for the work you do every day. So one of the things I learned about the pandemic and about crisis and the crisis management is that when your house is in order beforehand, when you are working with people, when you are leading with people of color, when you're working with people of color, when you're working with and not over, when you're in collaboration and in community, when you're in relationship and in trust, you're much better prepared to tackle these things. Crisis, pandemics, the pandemic of racism. So it was something I think Alicia said about everybody was scrambling. When this crisis hit us, we were scrambling, and certain spaces scrambling more than others. But when you have strength in your community and in your systems and in relationships with each other, then you don't have to scramble so much, right? So when you already have the people in the room who should be the people in the room, you don't have to go find them when you have a crisis and you need something, right? And so I want to just advocate for that in between these large civil rights movements, in between episodes of civic unrest, in between awakenings around racism and white privilege and the violence and the disparities that are experienced by non-whites in America, in between that spaces, we're doing the work we should be doing. And it's what Alicia said, if you're connected to Fort Ferguson, if you're connected to any of the organizations represented here by any of our panelists, then you're doing the work that needs to be done, and you're doing it not just in a time of crisis or a reactionary, but you're doing it for a liberated future. You're doing it for an equitable St. Louis region. So I want to thank all the people who were here today for everything that they do all the time, and for being here specifically for this hour with us and sharing in their own experiences and in their wisdom. Thank you so much. I hope that you will continue to join us for the conversations around COVID-19 and race. We will see you all next time.
Thank you.